This morning I woke up with like super like radiating pain in my pelvic area.
In the front.
And then kind of down, like it's literally all right here and then the lower back area.
Got it.
So I'm having difficulty like lifting my legs up, getting out of the car,
Okay.
walking.
So right now seated, if you try to lift your leg, it'll be painful?
Yeah, so like trying to get it up like that
Okay.
is hard.
And this one also?
Yeah, like socks today were difficult.
I bet. All right, so we'll see how that changes after the adjustment. Anything else? Neck and upper back?
I mean, my upper back has always kind of been an issue.
Also, when this starts to push forward, then for you to counterbalance, you're going to go like this also, because this goes back, the hips go back, so that's going to cause problems in your neck. Let's have you lie face down. We have a nice pillow for your belly, and we're going to check a few things and get you lined up. After the adjustment, I'm going to have you test and see if you can pick up your feet any easier. Okay. So putting your socks on won't be as hard. There we go. Good. Do you feel like you need to slide up a little bit?
I don't think so.
Okay. Excellent. Nice job. So one of the things I want to start with is I want to check your leg length to see if they're balanced. And what I'll do is I'm going to contact the medial malleolus on each side. And I'm looking right down the middle to see which leg might be shorter. It appears you're fairly balanced, which is nice. Now, however, when I look at this, this looks balanced. When I look here, you're leaning to the right. So there is something misaligned up here. And then the next thing we want to do is I want to bend the knees. I want to see how easy they bend. And so do you feel equal tension in your quadriceps?
I feel like one's further back than the other one.
Okay. Do you feel stretch in the front of your thighs?
No.
Okay. Which one feels like it's further back?
This one.
Okay, good. So do they feel even now?
No.
Do they feel even now?
This one feels more back.
Okay, so do they feel even now?
Yeah.
Okay. Do you feel any tension anywhere?
Maybe like a little bit right here.
On the right side? Got it. And when we go further, do you feel tension?
In the lower back.
Got it. In the center of your low back?
Yeah.
All right. Very good. So that means we need to adjust your sacrum on the left side. And we're going to use the drop board. This will be very gentle. All right, we're going to lift up and over. Doing okay? Good job. 2 more of those. You can handle 2 more? Just as soft tissue is what's tender when I press there, right? All right, here we go. Good. Was that one any different than the first one?
A little bit less.
Less sensitive? Okay, good. One last one. And how was that one?
Same.
Good. Okay. All right. And now let's see. Okay, that's a bit less. We are going to pull up on the front of the right side. So this comes up, this goes here.
Oh, man.
Too much?
No, I feel it like in the sciatic region.
Through here.
Yeah.
Got it. 2 more. 1 more. Good. Now, with your permission, I'm going to press into that muscle. Basically, you're balanced right now. I'm going to press right here. That's tender, right? Okay. And we're going to bend this, and we're going to move it side to side gently. I'm not pushing too hard, right?
No, you're good.
All right. But you do feel tenderness there.
Yeah.
Let me know if the tenderness changes. Keep your foot nice and relaxed. How long ago was your first pregnancy? 2 years ago?
Yeah.
2 years. You showed a lot faster with this one, right?
Oh, yeah.
Yeah.
Showing it like 8 weeks.
That's the drawback of second pregnancy.
Yeah.
Your friends with their first pregnancy aren't even showing at 20 weeks, and you're showing at 8.
Yeah.
How's the tenderness?
Not as bad where your finger is.
Uh-huh.
However, above that, like where the tailbone,
Yes. Right here?
that's still.
Exactly right there.
No.
Lower?
All right.
To the right. Got it. But it's not tender when I press.
No.
Okay, and that's not tender when I press.
A little bit.
A little bit there. All right. I'm going to hold that for about 10 more seconds. Tell me if anything changes. That's about 5 seconds. Doing okay? Good. Any change?
Not really. No.
Not really. All right. We're going to do a couple more adjustments. So this is going to pop up. We're going to go downward. All right. Here we go. No pain with that, right? Good. 2 more. One more. Good. And how's that?
A little better.
Wonderful. All right, so now I'm going to bend the knees and see if we've got even flexion. Okay, that feels even to me. This feels even to you too? Perfect. Very nice. All right, so now you're going to turn over on your back and we work on the round ligament, lower abdominal muscles, and we're going to adjust your upper back and your neck. This spot right there. Which one's more tender?
Definitely the left side.
Uh-huh. And here we go. This is going to come down and across. Nice. Did you hear that move? Does that feel any better?
Yeah.
Good. And below it, here or here? Oh, I think it's this one, right? All right. So this is C4 and C5. This goes to your shoulder. So we're going to go up and across.
Oh.
And back to center. How's the tenderness there?
Better.
Back to the first one.
Much better.
Good. And cross your arms and give yourself a nice hug. Fantastic. Okay, it's right there. Breathe nice and deep. Exhale all the way.
Oh, man.
How many was that?
A lot more than I've ever gotten.
There might be one below it on the opposite side. There you go. Felt okay? Nice job. All right. So now your inner thighs have a muscle there called the adductors. How is this? Look at that face. Pain. Don't make faces. We're recording this. Just kidding. Hang in there, okay? We're going to do 3 more. This is 1, 2, 2 1/4. Just kidding. That's number 3. Good job. Other side. You could feel the lumps under there, right? Yeah. There's a lot of muscle tension and knotted up muscles. Okay. How many of these do you want to do? 50? 55? How about just 3 more?
Oh, yeah.
1. Hang in there. 2. And last one. Great job. All right. Now, may I touch your belly? Yeah. Okay. So your navel is right here. This is the ASIS, anterior superior iliac spine, right there. That is tender. So we're going to hold that spot. This is part of what's causing that growing pain.
Okay.
This will subside in a few seconds. Let me know when it gets better.
It's definitely better than when you first pressed.
Good. Yep. It doesn't take long.
I mean, it's still tender, but
Yeah.
not as bad as...
Good. Yeah. Good job breathing through it. You'll need that when you deliver. All right. So we're going to wiggle the knee back and forth a little bit. Good. That's tolerable, right? Nice job. All right. So this is the side of the sacrum we adjusted. So we need to release the round ligament on this side. But first I want to check the same spot, the ASIS. It's a bit hard to find. Found it. That's as tender as the other side was.
The left was definitely a lot more.
Got it. That makes sense. That's what I expected. But let me know when this one gets better too.
It's already better.
Already better.
Yeah.
Wonderful. All right. See, this is why moms are special. You go through so much. So now I'm coming down to the lower abdomen. We're going to start on the side. How painful is this? Not bad. We're going to go closer to the center.
Yeah.
That's tender. All right, we're just going to hold this and let me know when the tenderness starts to decrease.
It's decreasing.
Good job. Let me know when it's significantly better. Like it goes down to a 2 out of 10 in discomfort.
Probably right now.
Good. All right. So while I'm on this side, I'm going to release the round ligament. Then we're going to do the same 2 spots on the other side, and then you'll be all set. So what we're going to do is go a third of the way from the ASIS toward the belly button. This is where that round ligament ends up. That's not uncomfortable at all, right? Good. So I'm going to hold this for a few seconds, maybe 10 or 15 seconds. If you feel any discomfort, you tell me right away. You're not short of breath or anything?
No.
Beautiful.
I am, but not because of what you're
Got it. Yeah. If you start to feel faint, let me know. We'll get you up. Just having the baby's weight on the arteries and veins in your abdomen is what makes you short of breath. So we'll do another 5 seconds.
The only thing I'm feeling, maybe from laying this way, is the sciatic.
Got it. On this side. Yeah, we'll address that in just 1 second. Now, abdominal tenderness. Any pain where I'm pressing?
No.
Okay. And this one?
Yeah.
Okay. And let me know when that gets better. Keep breathing. Nice job.
It's tender, but not super painful.
Good. We'll wait another 5 seconds. 4, 3, 2, 1. Done. Nice job. Now put this foot on this knee. Good job. That came up okay. Hands up here on your belly. And we're going to check the tension on the table here. So we want to go into a gentle stretch. Do you feel it stretching?
Yeah.
Same area as the sciatic pain?
Yeah.
All right, and we're going to drop down 3 times. Not too bad? When it drops, do you feel a quick, sharp stretch?
Yes.
Perfect. That's what we want. It's called a 1B afferent stretch. Good job. Still okay? All right, at least one more. Good. Now set it down. How's the sciatic pain you had back there?
When I go, like, if I push my bottom down, then it's tight.
Got it. How is it compared to before?
It's hard to say, just because the sciatic is always the one that's the most painful.
Got it.
Through the pregnancy, so.
When you first went onto your back, you said the sciatic's really hurting.
Yeah.
Is it at that level or is it different?
No, I think it's a little bit different.
A little bit different. All right. So we're going to do a couple of just distractions as well, just to pull that away and open up that hip for you. Good. Okay. So now I want to help you up, and then we'll do a couple things standing as well. So what I want you to do is hold on to my arm. Don't let go. Hold right here as well. And then I'm going to lift your legs, and then I'll tell you to sit up. Here we go. Good. Are you ready? Come on up. Good job.
It's still that, right?
Yeah, we'll go into a standing position. Nice job.
I don't feel as much at the pain that was
In the front.
Yeah,
Okay.
That feels a lot better.
Good job. I am glad to stand here facing the window. And what I'm going to do is use the activator gun. And we're going to do a little more to release that sciatic.
Okay.
And we're going to start on the top left, right here. What I want you to do is use the wall for balance and then lift your left knee up and then put it down. This one. You got this. Good. That's enough. Right one up and down. Good job. Right one again. And down. And left one again. And down. Beautiful. All right. Take a few steps in place.
like the worst person in the video for that. So much
You're not. We started late, usually we start earlier, like second trimester, but with you, we just started about 3 weeks ago.
Okay.
So I think you're doing well considering.
Okay. Yeah, I mean, I still feel tightness lifting up, like in the front.
Yep.
And then here.
Got it. So let's do a few more.
Okay.
Lift up a couple more times while I do this.
That right there is like.
That's where the pain is. Yeah. All right. Go ahead and lift up a few more times with that right leg. Good. And keep going. It's going to get easier. Good. It's coming up much nicer, isn't it? Good. Good. One more time. All right. And how's that? Okay. Good. You have to do a lot of walking. Now, you have a midwife or an OB?
A midwife.
Okay, great. So ask your midwife if you can wear a support.
I usually do.
You have one? Okay, great.
Yeah.
Does that help take some pressure off your sciatic nerve when you wear it?
And then my husband will come up behind me and lift my belly for me
Good.
as well. So that's
What a good husband you have.
Yes.
That's perfect. You haven't had any Braxton Hicks contractions?
No.
Okay, fantastic. If you do, let me know. I'll tell you what to do to stop those.
Okay.
All right, very nice. I'll see you again in a week. We'll keep at it. If you need me in between, give me a call.
Okay. Thank you.
All right, my pleasure. Good job. You got it.